Dr. Ruchi Malhotra from FS IVF Center, Delhi. I am a senior consultant. I have been working at Lady Hardinge Medical College for many years as a senior consultant. Thereafter, I worked at All India Institute of Medical Sciences, after which I came into this infertility practice. Today, I am going to discuss about artificial reproductive techniques or ART. Now, ART is a technique which is used for patients who are suffering from infertility. What is infertility? We define infertility when a couple is living together without any precautions and is unable to conceive after 1 year of total without any precautions. So when such couples come to us, we need to find out what is the cause, why they are not conceiving, and furthermore, how do we need to treat them. So there are certain basic tests when the patient comes to us for with such a complaint. First, most important is the history, whether the couple is living together or not. Sometimes it happens that the couples come to us, but the husband is traveling, husband is not living, so they are not having a normal sexual activity, because of which maybe they are missing the ovulation period and maybe they are not conceiving. Maybe there is some kind of a problem with the sexual problem within the couple, which also comes out in the history. Or there could be a problem with the hormones in a female. She might be having delayed periods or early periods or prolonged cycles, or maybe she is having no cycles at all. So these are the causes which we find out in the history from the couple, and then further we need to decide how we need to treat these patients. So ART includes many methods, most important of which are IUI, which is called as intrauterine insemination, and IVF, which is the in vitro fertilization. So first we will discuss about IUI. In IUI, the method is, first we stimulate the ovaries of the patient by giving them tablets and by giving them some injections. We make the eggs ready, which is called as the follicles, which will finally give us the baby. So follicles are then followed up by a transvaginal ultrasound, and in this, once we reach the particular follicle size, then we give them a trigger injection so that the follicle can rupture and come out of the ovary. Following which we take the husband's sperms and we segregate the best sperms and we inject them into the uterus of the female. So this is the process of IUI. Now, if we discuss about IVF, IVF is a totally different process in which basic treatment is we will give injections and we will make the eggs ready. Now, IVF is all about the number of eggs which we get from the ovaries. So we give them gonadotropins and we increase the number of eggs. And when these eggs reach a particular size, we under anesthesia need to take out these eggs. These eggs are taken out in a test tube in specific conditions of temperature, air and lab, and then we take the husband's sperms and we inject the sperms into the eggs. We leave the eggs and sperms together outside in a lab environment and we let the embryos grow. The embryos can go to stage 3 or to stage 5, day 5 or day 3 or day 5. So the transfer is then prepared, the uterus is prepared, and these embryos are then transferred into the uterine cavity. So this is the entire process of IVF. And after 14 days of the transfer, we can look for a positive result. आप भी इस इनफर्टिलिटी की समस्या से परेशान हैं और आपको इस चीज़ का कोई इलाज नहीं समझ में आ रहा, तो आप मेरे पास विज़िट कर सकते हैं। मेरा सेंटर आज़ादपुर सब्जी मंडी के बिल्कुल सामने है, आदर्श नगर मेट्रो स्टेशन के पास पड़ता है। आप डायरेक्टली भी यहाँ पर आ सकते हैं और वाया लाइब्रेट भी आकर मेरे से मिल सकते हैं। ऑनलाइन कंसल्टेशन भी हो सकती है और वाया वीडियो कॉन्फ्रेंसेस भी हो सकती है।